everyone, welcome back to Wisdom of Ages. So this will be, as promised, the first video, a couple mini-series for perimenopause and menopause. And I'm holding my phone and I apologize, the lighting is terrible and I do have a microphone, but I'm probably not even holding that close to my face like I should be. We're not professional YouTubers here, but that's not the point. I truly just want to get some information out there so you understand the importance of this stuff. And you know, it's a period of life that absolutely every woman is going to go through, whether you like it or not, and you're going to have these side effects, and you're going to have these residual effects of you losing your hormones. And I think it's important to know about it, to know a lot about it, actually. That way, when it does come time for you to make some decisions, or maybe you're in them right now, maybe you're in the thick of it. And I understand, I realize it's a big deal. And when you do have some of these symptoms, I'm going to talk about them, you can feel like your life is almost over, or it's a struggle to even get through your daily life. Hormones are a big deal, and when you lose them, it's even a bigger deal. So let's talk about that. What is perimenopause? So perimenopause is that period when you work up to actually full-on blown menopause. So it can start in your 30s, as early as your 30s into 40s, and that's when your estrogen and your progesterone are declining. They're slowly declining, and you're slowly gonna start noticing these effects, and we'll talk about that. But menopause then is when you actually have gone a full 12 months, 1 year, without having your menstrual cycle. So that's menopause. Once you hit menopause, you're in menopause, there's no going back. And perimenopause is the time frame leading up to this time. And during that time is when a lot of these issues come about, and it's crucial to correct them at that time. So let's see here. I have some notes that I wrote down. Symptoms of perimenopause, menopause. Let's start with the vasomotor symptoms. So common hot flashes, right? That's what you think of when you think of menopause. Hot flashes, night sweats, heart palpitations, sleep disturbances. This all happens when you have declining estrogen. Bone loss, what a lot of you probably don't realize, weakening of the bones, osteoporosis. So when you're losing your estrogen, that is a big foundation to your bone health. So, you know, when you get older and you fall and break a hip, you know, you lost your estrogen. So if you were younger, you fell and you probably wouldn't have broke that hip. So, you know, implication of bone loss with this, it's huge. There's premature estrogen deficiency. For example, if someone had a hysterectomy or an oophorectomy, so your ovaries have been removed, so that all affects your hormones. So sometimes people will say, hey, I had a hysterectomy, but my ovaries are still there. And that's great. And that's, you know, is preserving your hormonal health. But what some people don't realize is there is blood flow to that uterus, to the ovaries from the uterus. So when you remove that, those ovaries are no longer getting that blood flow, so therefore they're not going to be pumping out hormones like they're used to. So you very well may be feeling these effects from that surgery, and the doc may be saying, no, you're good, you have your ovaries, but that's true. So if that's you, you're not crazy, you know. Radiation, chemotherapy, these can throw you right into menopause. So if you have that history as well. Some other symptoms, genital urinary symptoms. So frequent urination, burning with urination, recurrent UTIs, vaginal dryness, pain with intercourse. So these are all symptoms of you having estrogen deficiency. And the FDA did approve for all of those conditions that I just talked about, hormone replacement therapy. It is FDA approved. Okay, so some additional research has shown that hormone replacement therapy can improve sarcopenia. So that is your decreased muscle loss. So as we age, and you'll hear me talking about this in some of our weight loss conversations, but when you hit the age of 30, you lose about 10% of your muscle mass every decade after that age of 30, unless you're doing something about it, increasing your protein intake, weight-based training. But you're losing your estrogen, and that's kind of like the topic today that we're talking about. Cognition. A lot of women will come to me with brain fog saying, I'm just not thinking like I used to. I used to be really sharp, and I just feel like I'm in a fog all the time. Yeah, that's true. You probably are, and it's your hormones to blame with that. That's not all the stress that you're going through. I mean, maybe, of course, that has a lot to contribute, but hormones are huge, and if you've never had them tested, well, how do we know? Skin and hair conditions, so thinning hair and skin, increased bruising, loss of skin elasticity. This is, wrinkles that can come from loss of your hormones. Diabetes, believe it or not. Hormones help with your glycemic control, and when you lose these hormones, your sugars can kind of go out of whack. So believe it or not, women on hormone replacement therapy have been shown to have better glycemic control. And depression. This is a big one. This is huge. So estrogen-based therapies may complement the response to antidepressants in midlife and older women. So maybe people are thinking, I need an antidepressant. Things aren't going well. Things aren't, maybe it's just the fact that you've lost a lot of your hormones, and that is changing how you're feeling. In fact, I don't want to say 75% of the time, but I don't really know the stat there, but it's huge, and it's a lot of the time. And if we can replace your hormone bioidentically, something that your body had and can still have to use rather than putting you on an antidepressant, doesn't that sound better, just to get you back to where you were instead of, something different? So this is something called the green scale. And if you feel like this is you're having these symptoms, or you're leading up to it. I've missed the belly fat, the mid belly fat. If you feel like I'm just gaining weight as I age, and I'm still eating the same as I always did, I'm exercising the same as I always did, I didn't change anything, but I'm starting to put on some mid belly fat. Thank your hormones, thank the loss of your hormones. You may be declining in some of this, and it's important to, get tested, and I'll talk about that in further videos. But the green scale, give yourself a 1 for mild, 2 for moderate, and 3 for severe, and 0 if you don't have any of these symptoms. And let's just see where you stand. So maybe get a pen and paper out and mark down to see if you have any of this. Hot flashes, lightheaded feelings, headaches, irritability, depression, unloved feelings, anxiety, mood changes, sleeplessness, unusual tiredness, backache, joint pain, muscle pain, new facial hair, dry skin, crawling feelings under the skin, less sexual feelings, dry vagina, uncomfortable intercourse, and urinary frequency. So if you have any of that, a score of 15 or over usually indicates that you do have estrogen deficiency, and it's likely contributing to your symptoms. So if you come to me and we talk about that, I usually begin the discussion of hormone replacement therapy. Of course, I do like to test your levels to see where you stand, where you're at. But when you're having these estrogen deficiencies, you are now at increased risk for cardiovascular health. You're at increased risk for osteoporosis, brain health, Alzheimer's. These things can all come from losing your hormones. So if you want to age gracefully without these symptoms, keep your youth, stay strong, stay vibrant, thrive, this might be you. This might be something that you should check out. And a lot of you might be wondering, oh, Kaylee, I've heard of estrogen replacement and that it causes breast cancer. So that's a topic that we're going to get into. We're going to dive into that, and I can't wait to answer all of your burning questions about it It's important. It's quite frustrating how this happened, but it's actually great that what we know now is what we know, and I'll explain all of that in the coming videos. So until then, until next video, stay tuned and let's strive to thrive like we should.